All right, so we'll go ahead and get started. We might have a few folks trickling in the next couple minutes or so, but hello and welcome everyone. My name is Morgan Sayak. I'm a senior program manager here at the National Safety Council, and one of the programs I manage is our SAFER initiative. Normally, this is a specific task force meeting for our SAFER members, but we've opened it up to all of our NSC members, so we're excited to have new folks on board. Just want to give a quick background about SAFER for those who are a little unfamiliar. We started as a necessity out of the pandemic to support essential workers, as things with the pandemic happened. But now we've kind of shifted over to topics that have been exacerbated over the last several years, and one of those being mental health. So it's my pleasure today to introduce our guest speaker, Suzi Craig. She is the VP of Workplace and Mental Health at Mental Health America. She's responsible for leading the strategic design and future direction of Mental Health America's workplace mental health programs. And many of you know today is May 1st, which kicks off Mental Health Awareness Month. And Suzi brings more than 20 years of experience leading strategic planning and entrepreneurial efforts, partnership and program development, as well as marketing and communications. Suzi's a graduate of the University of Connecticut, a certified yoga instructor, and has a certification from Cornell in organizational design. She lives in Connecticut currently as well. So I will go ahead and kick it over to you, Suzi.
Thank you so much, Morgan. So great to see everyone. Happy Mental Health Month. Mental Health America actually created Mental Health Month in 1949. So it's kind of exciting for me to be here with you all on the kickstart of Mental Health Month on May 1st. To be around safety people feels so right with what we're doing with our workplace program. And I'm going to share a little bit about that in a minute. So let's see if I can technically get my act together here and share slides. Let's do the from the beginning bit. Let's see if this works. Okay. How am I looking, Morgan? Good?
Looks good.
All right. All right. So today, really happy to be with you today. I'm going to share a little bit about Mental Health America. I don't want to assume that you know who we are and what we're all about. So I will do that, and about our workplace wellness program at MHA, which I lead with an awesome team here, and some trends that we're seeing around workplace wellness. And then I'm going to share what we're all about with Mental Health Month. We have a 52-page toolkit, which is it's a lot of information, but since we did start this whole thing around Mental Health Month, we like to go hard on the mental health pieces, so that give people enough resources. So I'll be going through that and hopefully give you some ideas. There are 31 days in May, so it's not too late to start your Mental Health Month planning. So I'll go through that, and then we're going to leave some time for discussion. Would love to hear some thoughts from folks after I share what I'm going to share. All right. So who are we at Mental Health America? Mental Health America has been around for a pretty long time. We were started in 1909. We are a nonprofit. We are a national-based, community-based nonprofit. We also have 240 affiliates across the country. And what are we about? Who are we? So there are a lot of folks in the mental health field, and they have different lanes and different ways of coming at what mental health looks like. We are all about prevention. We are about meeting people where they are. We're about breaking that stigma. We're about starting the conversation. We are really about ensuring that whether it's a policymaker, a company, an individual, schools, communities, wherever you are on your mental health journey and wherever you are on your mental health knowledge and what that looks like for you, we're able to connect the dots for you, help get you resources, and help really understand, what the state of mental health looks like for our people in this country, and also, what can you do with that information to get you or your loved ones or your company, your people, whatever it is that you need, right? And I really think what's interesting about us is we started from a man named Clifford Beers. Long history there. He actually is from Connecticut, where I'm from. He was a Yale grad. He started this organization after um, writing a book about how he actually found his way to health and wellness from being in psychiatric hospitals in Connecticut. So this is the early 1900s. He found his way to a healthy way, and he really wanted to make sure that everyone around him knew that just because you're living with a mental health condition or you're having an experience, it doesn't mean that that's the end of your story. As a matter of fact, it could be the beginning of your story. So I think that's really amazing that those are our roots and we keep those strong roots around advocacy going. And also, what's really interesting about Mental Health America is that we are a huge proponent of making sure that mental health is health. It's kind of our mantra. There is no health without mental health. I like to share this cartoon, really just to really drive home the point around the mindset that we have moving forward around mental health. Here we have a little koala guy. He's in serious distress. It's pretty obvious what the image says. Um, he's a koala. He spends what, 98% of his time in trees, and he's in distress because he doesn't have a tree to climb. But we have some very official looking people in suits, and their initial reactionary diagnosis is, oh, this little guy's got a mental health problem. So I think it's a pretty obvious message that brings home the point that if we're not literally getting to the root of the problem, then we're going to continue to see these statistics that we see every day. And we're going to continue to see people struggling. We're going to feel those struggles unless we really understand or getting to the root of the problem. So just something to think about when you're thinking about health. We often talk about physical, mental health, and it kind of the conversation stops there. There really are 8 dimensions of health, and this is supported by the US Surgeon General and the World Health Organization, the CDC. If you go to those organizations, they will advocate for what we're advocating for, which is let's paint a more complete, a more complex picture of well-being. And just understanding that and knowing that someone's mental health could be sourcing from somewhere else is a really important place to think about as we're moving forward and having these conversations. So what is our workplace program like? So I have been at the national organization for less than a year, starting in 2023. Before that, I was at Mental Health Connecticut, and for about 8 years, I was our chief strategy officer here. So I've been in the Mental Health America family for a while. And one of the reasons why I'm so excited to be at the national level is because of really how we've been leading the charge around supporting companies on their journey around making mental health a priority in their organizations. And we've been one of the first to be doing that in a bunch of different ways. We're just wrapping up our national certification, literally just wrapping it up a couple weeks ago, where we've been certifying um, uh, close to 300 companies now, and recognizing all the efforts that they're doing around mental health and supporting their employees, which is an amazing program. It's really the backbone of what we do at Mental Health America. We do a lot of research. We do a Mind the Workplace survey every year, and from that research and from our learnings from companies, we build out best practices. We really want to make sure that we're staying ahead of the curve and putting those best practices out there so that leaders, HR pros, wellness champions have those best practices to go to, so they know where to start, and they have places, to bring in and tailor to their organizations, so that we can all really move the needle on health and wellness for our workers. So that public education and those resources also really come into play too. We're lucky to have a lot of great support and funders to make sure that we can give away a lot of stuff for free. And I'm really happy that we're able to do that so that you have all those free resources. So, and that is our home base online if you want to go check out all of our resources. Um, and one other thing, I know I mentioned our affiliates cross country. We are working with those affiliates right now. It's just a core cohort of our affiliates in different states and regions who have wellness programs. They have workplace wellness programs as well. And so we're working on building a strategy to build a very, a much more robust rubric of how national and our affiliates work together so that we can increase the programming across the country. So if you have any questions about that, let me know. I can get you connected to an affiliate in your state. And if they are, don't have a program set up, or, if they do have a program set up, either way, you can have a conversation with them if you're interested in working with them on the ground at the local level. What is our philosophy? This may seem a little bit obvious, but it is worker first, right? Like I said, we are, all of our work is rooted in lived experiences, rooted in the individual. Moving forward, where we are going to build out and strengthen our work is really making sure that worker first approach is 100% aligned with the strategic priorities of the organization. What are those KPIs in your organization, and how can we make health one of them, right? Because what we know from the companies that we work with and all of our research, a thriving workplace environment where you have a mentally healthier workforce 100% leads to the prosperity and the health of your business, right? We just know that. So making sure that, and this is just a huge priority of ours, making sure that when we're sitting down with companies and helping and supporting them, that we get beyond that competing priorities conversation. Well, it's this or this. No, let's talk about how we can align these things together. And not every company has all of those resources to make those big investments in resources, and that's okay. There are all different ways that companies can at least start the journey to make sure that mental health priorities are incorporated in organizational priorities. And once you start that chain rolling, you see benefits, almost instantly. Okay, so we have a quick poll. It is, just a light question. Um, what keeps you up at night? And this honestly, it's an anonymous poll. If you don't want to take it, it's totally fine. But I'm just always really curious. If you're working and leading an organization, if you're supervising, or even if you're, if you're a frontline worker, you're an employee, like, are there things in your workplace that really keep you up, and what is that? These are some of the things that we've learned from organizations. So I kind of handpicked these based on what we know from working with companies, but it could be something completely out, completely different. Is it people using the benefits? Is it retaining workers? Are you doing enough to support workers? Is it everything? Maybe you don't know the source of stress in the workplace, or maybe it's something else. I'm just really curious.
And I'm
Does that-
not sure, Susie, are you able to see the
I can only see the answers and the question.
answers? Okay.
Mhm.
I'll just chime in right here and kind of give you a little synopsis of what people are selecting here. We've had about 60% people respond. So thank you everyone who's responded. It looks like at number one, people are worried about if they're doing enough to support their workers. And it looks close in second, everything, everywhere, all at once, keeping up
Oh,
with all of it.
I'm so sorry. Yes, that stress is real.
Yep, yep. And then it's looking like the main source of stress in our workplace, as well as how to retain workers. And then if workplace wellness investments have a true ROI. And then we have a handful of people who've selected others. So
That's great.
yeah,
Yeah.
so we'll go ahead and
So yeah, you
we'll
can
close out that
go
poll.
ahead, close out that poll. I think it's really interesting, um, I've been doing this work for a while, 4 or 5 years ago, let's say pre-pandemic, I would say, this is kind of conjecture, but based on conversation that I had back then, the number one would have been, what's the ROI? Give me the business case. Tell me what all this is really going to do. Um, so it's kind of cool, and that's definitely a question that we need to answer for sure. But it's cool to see, that that top slot is really like, are we doing enough? And then I shouldn't say it's cool because it's a stress factor for a lot of leaders, but that's where the conversation needs to be, right? That's where the conversation needs to be. And I would say it's, what's good is, can I move my slides? Oh, there we go. Um, that word enough is really important, because it's not about volume, right? It's about the right things for your worker population. So let's talk about that a little bit. Um, Oxford University came out with this study. You might have seen it in January. It was everywhere. Me and my team were doing a little bit of a cheer and a dance, which may sound weird, because what they were saying was that the workplace wellness program is dead. And they were saying very specifically, pointing to that the approaches and the programmatic investments, they were calling out as dead. And really, what Dr. Fleming was saying in his research is that if you're investing in mindfulness apps and you're doing training and you've got benefits like discounts to a gym and all those things are great. Like, he's not saying they're bad, all those things are awesome. However, if you are investing in those things and expecting those things to do the heavy lift of really getting at and addressing the root of stress and mental health and well-being, that's where it falls down, right? We're talking about, the working practices, as he calls them, like, and this is a study in the UK, but really, I think this definitely applies in our country as well. We're talking about the best practices, and how we can invest in those at a strategic level. And this fully aligns with the research that we've done at Mental Health America. um, and I have a quote here from our last Mind the Workplace survey results, which came out at the end of 2023. We have, and that link will either be shared later or now, but if you go and just read through that. We've got a lot of numbers and statistical interesting things to share that 100% lines up with this idea about the strategic approach. But there's all these great anecdotes, what really kind of like brings home like what the experiences are for workers. And this one in particular, talks about how she had a very specific experience, a very traumatic experience in something that required an action, and she wasn't getting it from her employer. So, um, one thing to really consider is that if the work isn't being done with managers, supervisors, with training, with understanding, what is the organizational response to when things happen, if that hard work isn't being done, if the response is, well, here's a mindfulness app, that's going to do more harm than good, right? So, really understanding that where we're going is that the expectations from workers is getting really high around what the support is looking like from their employer. I won't read all of this, I promise. There's a lot of words on the slide here, but just know that we're really looking at what the trends and priorities are moving forward. Obviously, the shifting work environment. Yeah, I really love the Safer Task Force from NSC and what they've been doing, and the fact that they stopped everything during COVID to say, "Oh, we need to help." Companies around what safety in the workplace looks like. And I love that you're shifting gears and really incorporating mental health. That's amazing. And that's what we all need to be thinking about. The workplace has changed, it's not going back. The idea around flexibility and support are daily conversations that you need to be having in your workplace. I just heard an interesting fact that the 4-day work week was actually, that idea came up in the 1970s. And there was a campaign called Thank God It's Thursday. I had never heard that before, right? And we're talking about it like it's a new thing. But back in the 70s, it was a hot thing that everybody thought was going to stick. and it hasn't. So it's just interesting to think about, like, there's been a push and a way to redesign and rethink about what the work environment looks like moving forward, and that's not going to go back. 4 generations in one workforce. I'm actually giving another presentation at the end of this month around that. Really interesting to think about the multi-generational approach. What does it mean to support workers from different generations, and how can we create a healthy supportive environment where those generations are learning from each other versus clashing against each other, which can cause a lot of stress and anxiety in the workplace. DEI, obviously that conversation, thankfully, has come on the table. And again, now let's please move beyond the programmatic. We have a DEI training. We have, it's a part of a conversation here and there that we do. No, it really needs to be a part of our policies and our practices and who you are as an organization to see some real shifts in that area. The employer role supporting wellness, I think it's safe to say, and you know that that poll that points to, are we doing enough to support employees, really, I feel for the leaders, because I think there is a lot of stress and there is a lot on their shoulders to think about things they haven't thought about before. But I think those are all great conversations to have, and knowing that, if at a basic level, if you are starting the journey and starting where you can to support your employees will respond. And it starts by building that trust and creating that strategy and making sure that your employees know that you're trying to do something. That in itself will go a long way. And then obviously we just talked about workplace wellness programs being dead. But again, just knowing that you're taking a strategic approach is really key. There's a really easy poll. Just really curious as we kind of shift, we're going to shift the conversation and talk a little bit about safety. How am I doing on time here? Oh, not
You
too
are
bad.
doing good. We're
Okay.
almost about halfway. So it looks like answers are still coming in, but about 43% responded no, 37 responded yes, and about 20% said they don't know / are unsure. So
Yeah, sounds about right. All right. Well, that's interesting to know. That's about what I expected. And if you are thinking about, well, what does she mean psychological safety as far as policies and practices? A lot of it goes back to training managers, understanding how to respond when situations happen, in the workplace, and really thinking about um, safety. And now I'm getting into the lane with safety people, and I'm going to make sure I try to stay in my lane around mental health and emotional and psychological safety. But really at the core, we all know that safety is about risk. It's about avoiding risk. It's about identifying risk. It's about making sure that you're doing as much as you possibly can to avoid any potential event, right? And the same thing is true around psychological safety. I think maybe many of you have even seen this graphic, never mind this quote. I think it's kind of everywhere. I've seen it probably in about 10 presentations, which is great. Amy Edmondson, who coined the term, this quote really gets at the core of it. And it's really about what happens when someone raises their hand or speaks up or says, this happened to me, or I'm seeing this, or, this is my experience. It's about the response, what happens when that person does. And what we've learned in when we do our research, the research is really rooted in comparing what happens in healthy organizations, and what happens in organizations that have been defined by the workers as toxic or unhealthy. And I think this quote, from our research really brings it home that if you're in a healthy work environment, and your company invests in developing people managers, really invests in understanding that those soft skills and all of the training that managers need to support people, they report, having a much greater experience than 3% of the respondents in unhealthy work environments, right? So, just knowing that, at the root of all this really is making sure your managers and everyone at the organization gets what they need to support each other. And I think is some interesting stats around this is that, we're also, we are moving the needle, and we are moving things along and we have some work to do. These are kind of opposite stats that kind of show that. So, of workers who feel mentally or emotionally safe in the workplace, 81% report that workplace stress does not affect their mental health. So, how great is that? I think we talk about stress, stress, stress a lot. Stress is also just, it's a thing, right? If you're working in a job, you're going to have normal deadline stress, or it's just going to be a thing. But what is important to understand is kind of unpacking that stress, from having an experience, that really, is going in the wrong direction, right? But if you feel safe and supported in your workplace, you're gonna look at and be able to, disconnect those things. But we still have some more work to do. I think this statistic is really important. 2 in 5 employees regularly experience microaggressions at work. That's not good. That should be something that we should all be working really, really hard to make sure that, we change that stat moving forward. So one of the companies that, we work with, really closely is Hot Topic. We have a case study on our website about them. They're really an amazing company. If you don't know Hot Topic, then you don't have a teenager, or maybe you weren't a teenager, but, they are a retail giant, and they really are. They're like pop culture, concert T-shirts and lots of fringy kind of, apparel. But their core values and who they are as an organization, is really, really true to supporting people that, find themselves on the fringe, people that feel marginalized. They attract a lot of folks that don't feel like they fit in with the normal quote unquote populace of folks, right? And they're huge proponents of LGBTQ community, huge proponents of, hiring folks who have, mental health conditions, and everything that they do to support their people is really, just comes out of the DNA of their culture. And so we did this great case study of them, and with one particular district manager who shares the story of how he revived a long-standing store manager who was about to leave and who was really struggling personally, not doing well, at her store, and just the way that he, built trust with her and created a whole plan to support her, turned not just the store around but turned her life around. So, um I share this story a lot because I share it because just to show that, it is hopeful to do this work, and if you put the right tenants in play to support your folks who can support, workers throughout the organization, you're really going to see the benefits with your business and with your people. So here's just a handful of some of the companies that have been certified, with us, and they all are doing like interesting, creative, ways of supporting their organizations. So it's just really cool to see, these, and there's a lot of small organizations that have been certified as well. It's a very rigorous certification. We're really proud of the fact of that. Less than 25% who are interested in getting certified actually make the cut. And we keep it rigorous for a reason. We want to make sure that this is not a check the box, that folks are really doing the hard work around this. So that work will continue, and we're hoping to make it to 500 people, certified, company certified, next year. Okay, Mental Health Month. Also, I'm happy to stop now if anybody has any questions, but you tell me, Morgan.
I don't see that anybody's
Okay,
anything in the Q&A quite yet, but yes, folks, feel free to go ahead and ask any questions in the Q&A box, and we'll be sure to get those answered for you.
great. Oops. Um, I just realized something, Morgan. Did we record?
We did.
Oh, we did. Okay. It's weird. I can't see it on my. the whole presenter thing. Okay. Okay, so it is Mental Health Month. Our theme this year is where to start. It's also the title of a book that we published. It's in hardcover and it just came out in paperback. It's a really amazing book. It is, um, it's great for quite literally anyone of any age to have the conversation around mental health. So that's available, but this is the link, and I think it'll probably be in the chat as well, as far as downloading different elements of the toolkit. Like I said, it's 52 pages, so it's a lot, but there's a lot of great stuff in there. I wanted to point out that we do some really cool stuff. Green is the color of Mental Health Month, and I know it's May 1st, you probably already have some of your plans in place, but it's not too late if you want to light up your office building, or if you want to talk to your town to light up green. There are bridges. When I was working in Connecticut, we had all sorts of, businesses and towns and state parks and all sorts of people that got involved in lighting up green. And you can do it for one day, you can do it for the entire month. It's just a really cool thing to do to show your support. And then we have, obviously t-shirts, but if you don't have t-shirts, you can also just wear green. Um, so just know that the green theme is always good to rally around. Some things that you'll find in the toolkit specifically for organizations: email templates. So, language that you can craft around communicating, honoring and supporting Mental Health Month. There are posters, postcards, tips for planning an event. Um, really think it's a great time if you're really serious about looking at your practices and policies. Stop and do that. There's a link right there, and we'll share these slides after so you have them as well. Like I mentioned, our mental health affiliates, a lot of them are doing awareness activities. So connecting with your local affiliate is a great way to really elevate the mental health month conversation. And then, just in thinking about how to promote and what to say around mental health month, one of the best practices, it's really for leaders. It's kind of in the number one slot, is for whether you're a CEO or in the C-suite or not, or you're, wherever you are in the organization, sharing your story and really talking about how mental health affects you is a great way to kickstart that conversation and show that you're making it a priority. Promoting mental health screenings. There also, we promote this idea of building wellness kits. It doesn't necessarily have to be from our stuff, it could be from anywhere. You can have this beautiful Zoom background, and there's a couple other templates out there in the toolkit. And then obviously we do a lot of social. So that's just one example of the social that we do, but you can use our graphics or you could just reshare what we put out there. One specific thing I wanted to point out: if you do anything, share this, download this PDF. It's a 4-page PDF. This is just a screenshot from the first page, but if you do anything, I would say, this would be at the top of the list. These are just, it's amazing resources. Takes you a minute to go through because there's a lot, but if anything, have those resources handy or share them with your employees. But that's always really a great place to start, is just having those resources to share. We have 3 webinars, really interesting ones. One, I think they're every week starting next week. The first one is, actually, I'm not sure which order these are in, but one is about, somatic practices for your mind and body. One is about neurodivergence, amazing. And then another one is about AI. So really, really cool webinars. If you've never been on an MHA webinar, highly recommend. We've got an amazing team producing that content. Um, this is just a shameless plug number one, to take our survey. Please share this out. So our Mind the Workplace survey is where we get, really the core of our data and how we build our best practices. So I have the link there, and share that with your employees, encourage them to take it. We've already the survey's only been out about 3 weeks, and we've already like blown past our numbers for people taking the survey, which is awesome. And shameless plug number 2, we have our annual conference, which has been moved to September. Very excited about this one. Disrupt, reform, transform. Really focus on innovation and the next wave of mental health. Very, very excited. So I hope to see you there. And there is my info. Boy, it was a little speedy. I think I kind of like
No
Mhm.
worries. So we did have one question roll in. So you
Sure.
mentioned the certification process with various businesses. We had someone ask how long the process is typically.
Sure. So, we run the application process from January to the end of March. So it's a 3-month process. So it's each year during that time. Um, what we recommend for companies to do is, and again, we give a lot of us our stuff away for free. The application and to apply is not for free, but we share the application questions, and I can give those links to Morgan. She can share those out for everyone. Download the application questions. There's also a 10-minute pre-assessment survey just to see where you might land in the certification. So you take the 10-minute assessment survey, you can download the questions, and it's just good to really use that as a roadmap, right? Going through the different areas because we cover leadership and culture, we cover benefits, compliance, um, policies and practices. So looking at those different areas and using them as a roadmap to see, okay, where are we doing great, where are the gaps, where do we need to invest moving forward, is a great way to build out a strategy for the year.
Thank you for that.
Yeah.
I'm just getting
And
my
all the information is on our workplace wellness hub. There's a whole section on it's called the Bell Seal certification. I've been using Bell Seal because we're changing the name. Spoiler alert. I don't know what the name's going to be next year, but but just there's a tab on our workplace area that says workplace certification.
okay, great. So we'll just keep it open here for a little bit for any additional Q&A. Someone did ask if they will receive access to the recording. And I just want to say yes, everyone will receive access to this recording, a copy of the slides, and then all of the links that were shared on today's call, because I know there were a lot of them. So we will send an email with all that shortly after this call today. So any other questions or anything we can assist you all with? Looks like we have one more. Oh, another question kind of following the survey. Will the employees get anything in return or at least ensure assurance their data will remain confidential?
So whoever fills out the application, we recommend having one person run point on filling out the application questions. It's usually HR, someone in operations. Sometimes it's the marketing person. That person shares the data with us, and the questions are very much high level around what the company is doing to invest and support employees. We do ask, are you doing employee surveys? Are these decisions being made on employee feedback? Right. So it's very much about what the organization is putting into play and how you're, organizing your decision making around the investments you make. And then, obviously what is the result around that as well. So we're not asking for any specific individual, no HIPAA, no nothing. And only we see it. Only our certification folks see it. No one else sees it.
Thank you. Another question. What are some common misconceptions about workplace mental health and how can employers address them effectively?
Oh, that's a good question.
Mhm.
Um, you know, I hate to like kind of be a little bit repetitive, but you know, definitely when we start having the conversation with companies around mental health, the first conversation from them is usually, I need a training, I need a webinar, I need like something. And it's not like the tactical things aren't bad, they're good. But our questions back are usually, okay, if you're bringing in a training or you're paying for a mindfulness app or you're going in that direction of bringing some external support in, how does that fit within the culture and with what else you're doing to make sure that employees can confidently and honestly say, my employer is doing everything they can to support me as a person. So there's a term out there. I didn't use it in the presentation, and I hesitate to use it because it feels a little icky. But there is a growing term out there called organizational gaslighting. So, and really, what that means is, do you actually know what the experiences are from your workers? Do you know that they're getting what they need from their manager, from HR, from leaders, from their coworkers? Is a supportive environment where someone can say, when something goes wrong, I know where to go. I know that, there's this request for dot 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 is not going to bite me in the you know what, right? Like I have all these things
Mhm.
in place so that when something goes wrong, I know what the response is, and I know I'm going to get help, and we can, I can move forward, and I know I can be supported. um a lot of times, we hear from companies like, yeah, we're worried about retention. We're worried about people, leaving our organization, and we don't always know why. And I think that's, that's one of the biggest things is knowing exactly, what the actual experiences are of your workers will help give those clues as to where, you need to invest in the support. I hope that's helpful.
Yeah, no, absolutely. And I definitely appreciate the ear term company gaslighting and everything. I feel like just gaslighting in general has blown up in the last
Yeah.
several years. So, um, another question, how can companies ensure that their mental health policies are inclusive and accessible to all employees, including those from diverse backgrounds?
That's a great question. So we have, and I don't know if I can put my hand on the resource exactly. Feel free to email me, and I can find it for you if you can't find it on the website. So understanding your worker population is number one, and also understanding, as much as possible. Not everyone can share. Not obviously, employees need to be feeling safe with sharing in their lives, about where they need support. But making sure that, you're doing everything that you can to train your managers. And I probably said this maybe too much, but train your managers to understand, what are those very specific needs from different worker populations and how can they be supported. And also it knowing about accommodations, understanding about, is someone, coming in with a disability, are you inclusive around that? And really just having that broad definition of inclusion, belonging, and DEI is really important. Are you attractive to folks that, um, are hard of hearing? Like, whatever it is, in understanding like what those specific potential needs are, and what the specific needs of your worker population, it really starts there.
Great. Thank you for that. And I definitely agree. I think, understanding the needs and wants of your staff and employees can be definitely a great place to start. We had another question come in. Any particular jobs or industries do you see mental health within any type of data?
Um, as far as, how it looks different in different industries, that's a great question. We need to be, honestly, Mental Health America needs to be doing more to understand that. We have a, uh, outcomes report from our latest certification. Now that that's wrapped up, we take, at a high level, we kind of take all that data and, learning from companies and what they're doing, and we map that out to see like all of these best in class companies, what are they doing, how are they getting it right. So we learn from that, and we create an outcomes report around it. Obviously nothing specifically tied to companies, but overall at a high level. And so we have a lot of healthcare companies. We have folks in, construction, AEC, and we have really a broad diverse of industries, some more than others. And we need to be doing a lot more to understand specifically what does the work environment look like for deskless workers, right? We can't assume that folks, everyone's in front of a computer like myself, right? And how do you reach those workers? I think that is one of the big questions. If someone is not in front of the computer all day long, and you have all these resources and they're not using them, they don't even know they exist, like how do you actually reach those folks? It's funny, QR codes have been around for, like, I don't know, a couple decades. And thanks to the
Yep.
pandemic, people actually know how to use them now. So like there's this whole movement of, just making sure that, folks have that easy access and using the QR codes and other ways to reach folks that are not in front of a computer. But to be honest, we don't do enough to understand what's happening in different industries. So, but we want that to be a priority for us moving forward for sure. But thank you for that question.
Yeah, no, thank you. And thank you for, like you said, being honest and saying we need to do more in that area and everything. So, and I guess kind of piggybacking off of that question, can you share a success story or a case study of a company that has successfully prioritized mental wellness in the workplace? I know you probably have to keep companies confidential and everything, but maybe just on a high level, if you can just maybe talk about a company that came to you where they didn't know where to start, how you all helped, or, something along those lines.
Sure. Yeah, I talked about Hot Topic. They're kind of my go-to because I do have permission to talk about them. Um, you know, what's interesting is that it really depends on size of the company, what the specific worker population is, what they've been doing in the past, as far as, within the context of who is doing it right. It really is, I hate to punt this, but it really is dependent on a lot of factors. What I think is really, really cool and interesting is looking at smaller companies. I'll give you one example: small online retailer. Employee base is around 60 to 70. They might have a little bit more now. Um, they're so invested in a part of supporting their companies as a part of their culture, and they're in the auto business, online auto parts. And over the pandemic, their folks were really, really struggling. Very young workforce. They had to move to remote. Never done that before, so they had huge changes. And then they were, because it was the pandemic, a lot of people's hobbies called for this company to be very successful, right? So they had this huge growth, and so they just doubled down on investing in their HR department. They had a 4-person HR department for employees, total of 60, 70. That's a lot. But that investment really, really paid off, and their retention levels went through the roof. They had these big conversation about company values and, who they are as a company and how that translate into support. And so they had all these like massively hard conversations. And the two guys who own the company were just up for it. They kind of stopped everything and they said, "Yeah, okay, we need to actually, question, some of the decisions that we made around our culture, and not make any assumptions, and really understand what these experiences are like." And they found a lot of um, work had to be done in training their managers. I know I said this a lot and I sound like a broken record, but it happens a lot, right? That people get promoted because they're really good at their job. And I feel like a lot of people are nodding their head because I hear this so much. People are good at their job, they get promoted, and then where it falls down is knowing that you have a new job now. As a manager, it's a different job. You need different training, you need different support, like you need different support as a manager. And you need to understand what it looks like to, you know, you're not the friend of the people who work for you. You are a manager. Of course, that means being supportive and empathetic and all those soft skills, but it's just a different thing, right? So it's a great example of a company, that really did the hard work and had the hard conversations, and then they put the investments where it made sense for them. Not everyone has the luxury to have that ratio of HR people to company size, but it doesn't mean that you can't have a wellness committee and really find the people that are championing, health and wellness in your organization and giving them the support and the training to support your coworkers, right?
Yeah, no, thank you for sharing that story. And that's definitely great. And, our safer team, as much as we hated the pandemic, and as I'm sure many people did, it's really brought in mental health, and having the conversations about it brought to the forefront, which has kind of been a silver lining, I guess you could say, around all of this. So
Definitely.
we'll have one more question and then we will close out for today. What are some early signs that an employee might be struggling with their mental health, and how can colleagues or managers offer support? So you kind of touched on that in your last answer there, but if you have anything additional to add.
Absolutely. So, a couple of things. One is I can't recommend enough mental health first aid training. And they have one for the workplace. I've gone through it, I think, at least 3 times. This is in the States, it's the National Council for, they changed their name, National Council for Mental Wellbeing. If you just search for mental health first aid, it is a lot of time. It requires definitely an investment, but it is worth it. Specifically to help build and understand really just the language and what does it look like, um, to see and identify when someone is struggling, and then what is the response to make sure that it's the response that that person needs, that doesn't cause more harm than good, that actually gets them what they need, right? So if you're become a mental health first aider, it's not a clinical therapeutic thing, it's really just about getting people connected to resources and understanding how to have the conversation. And then there are other trainings out there. And again, depending on where you are in the country, I might be able to get you connected to an affiliate if one of our affiliates is doing this work. You could have a, 1 or 2 hour workshop just focused on supporting managers and helping them, identify those needs when someone is struggling. But I'd say at the top of the list, if you see change in behavior, so if you have someone who was always, coming to the break room and having lunch, and they engaged in such a way and suddenly that has completely shifted, that's a great opening to say, hey, I noticed, maybe not everyone gets to go to a break room anymore because we're working remote, which makes it extra hard. But having a check-in, and just if you feel like something's off, checking in without anything other than, "Hey, everything okay?" And by the way, if you don't feel safe talking to me, can I help you find someone to talk to, right? I mean, it sounds simple, but you know, how, how much do we get that from people? How much do people just stop a meeting, and I start every meeting with my team. We don't start with any work stuff at all. It's always like, where's everybody at? How you doing? And it's not a forced thing either. It's really, hopefully it doesn't feel forced. Hopefully it's more natural, like, what's going on? How was your weekend? How are things going? And one of the best practices around creating a safe environment is to really just be human and be open and allowing for people to feel safe to tell you when something is not right. Even if they can't put words on it, they could tell you, "Oh, I'm stressed. I don't know where this is coming from," or "This happened." So again, I hope that helps. I know it's kind
Yeah.
of like common sense, but I definitely recommend any kind of like basic mental health 101 training or mental health first aid to at least get the language around,
Mhm.
and understanding the signs and the symptoms. Um, because we all have experiences, right? It doesn't mean there's a diagnosis or anything, that requires an intervention. It could just be like identifying where you're at that is different from your usual baseline.
Yeah, yep. That reminds me, in one of my old jobs, we had a graphic of, I believe, an elevator kind of going up and down to the different floors. And if you were on the top floor, that was like the best mood you were in. If you were on the lower level, like you were at the bottom of the mood elevator. And so we would kind of say that to people like, sorry guys, I'm at the bottom of the mood elevator today, something like, so definitely appreciate those kind of conversations. And like you said, we don't have to go necessarily into detail, but just so people just kind of know, like, all right, they're having an off day or something, so
Yeah.
you can support them a little better. So,
And one of the best things you can do is to give people the tools to build that self-awareness, right?
mhm.
So, you know, I work for Mental Health America. We're all very open about where we are. I work with some folks that are very open about being neurodivergent. I have ADHD, I have anxiety and depression. I'm very open about that. And so there are different ways of talking about this, right? Our folks who don't actually like a lot of social interaction will tell you where their social battery is at, right? And they'll
Yeah.
tell you when they need to tap out.
Mhm.
And we work in an environment where we're like, okay, there's no repercussions around that because it's like, oh, they're just very open about like where they are.
Yep. Nope. I appreciate that. So we're at 5 minutes out. So we'll go ahead and just thank everybody for attending today's call. And a big thank you to you, Susie, and to Mental Health America for coming on today and sharing your guys' resources and just touching on such an important topic. I'm excited that workplaces are starting to have these conversations and discussions and just being receptive to all these resources out there. So I hope everyone has a good rest of your day. Just kind of closing out here, our next meeting we'll be having in July. We'll be having a similar workshop to have a guest speaker come on. July is BIPOC and Mental Health Awareness Month. So we're hoping to get another great speaker and organization to come on to talk about those topics in particular. And if you have any questions, again, you'll get the slides here with Susie's contact information. So feel free to reach out to her and, download the great resources that she shared today. And in the meantime, if you have any other additional questions, feel free to reach out to us at safer@nsc.org. And with that, thank you so much again, Susie. And we look forward to seeing everyone at our next meeting.
Thank you. Thank you.
Bye-bye.
Take care. Have a great mental health month.